Welcome to today's press briefing by the Command and Coordination Group. We have with us the Chief Executive, Mr. John Lee, Secretary for Health, Professor Lo Chung-Mao, and Controller of the Center for Health Protection, Dr. Chui Lok Kim. The CE will first speak, to be followed by Professor Lo, and then the floor will be open for questions. Each reporter will be allowed to ask no more than 2 questions. CE. I call this press briefing to make some announcements. These are further relaxation of our anti-epidemic measures. I would first go over the salient points of these enhancement measures before I hand over the floor to the Secretary for Health for details. He will also give you the reasoning for these changes. These enhancement measures include 1. Lifting of the quarantine order. There will not be any more close contacts. However, we will issue health advice to these people via the confirmed case. 2. Cancellation of the vaccine pass. We will adopt more targeted measures, in particular vaccination for the elderly as well as the young. 3. We will remove all mandatory PCR tests for inbound travelers. Visitors coming from overseas, the mainland, Macau, and Taiwan do not have to do mandatory PCR test when they arrive at Hong Kong. Instead, RAT will be required all the way through the 5th day. 4th, cancellation of all social distancing measures restrictions. That includes the prohibition of group gathering, required distance of 1.5 between tables, seating capacity of each table, etc. However, the wearing of mask requirement will be kept. These enhancement measures will come into place on the 29th of December, that is tomorrow. And these are our considerations for the introduction of the enhancements. First, overall speaking, we have a relatively high vaccination rate. Coupled with that is the 2.5 million people who have been infected. Our society as a whole has built an extensive and high-level barrier of immunity. 2. We have sufficient anti-epidemic medications that are effective in Hong Kong. 3. Over the past 3 years, our healthcare staff have already accumulated sufficient experience to react to the epidemic. 4th, the hospital authority has enhanced their emergency response system as well as the healthcare system as a whole. Their capacity to use resources to put in place effective responses and capacity have all been enhanced. 5th, with 3 years of experience gathered by members of the public on COVID-19, members of the public are very well equipped to protect themselves. 6th, our anti-epidemic measures will focus on the protection of high-risk groups and to guard against serious conditions and death cases. These high-risk groups include residential care homes for the elderly and those for people with disabilities, as well as the old and the young. These measures aim to help Hong Kong resume normalcy. We'll continue to monitor the epidemic situation, including measures relating to isolation orders. We will continue to study further enhancements if possible. I will now give the floor to Professor Lo to give you details about these measures. Professor Lo, please. Thank you, Chief Executive. People of Hong Kong, the government has been acting on the basis of reacting to the epidemic with a precision, balancing anti-epidemic measures against requirements to resume normalcy. We have been taking gradual steps to make adjustments to all our restriction measures so that members of the public can resume their normal activities and for Hong Kong's economy to recover so that we can reconnect with the rest of the world. I will now give you further information about the latest situation of our measures. First, there will not be any more close contacts as defined, and there will not be any more quarantine orders. We've been fighting against the epidemic for 3 years. We have an increasing vaccination rate as well as an increasing level of immunity barrier in our community as a whole. Our capacity to tackle epidemic challenges has also been enhanced. We see a large number of confirmed cases in the community, which makes it difficult to identify close contacts. And quarantine orders has further increased the cost to be borne by society as a whole. In order to help our society as well as members of the public to resume normalcy, we've decided to make changes to the classification of close contacts and the arrangement of quarantine order issuance. In other words, family members of confirmed cases and other close contacts will not be put under mandatory testing requirements and quarantine arrangements. They can freely move about. Health advice will be issued by the Department of Health to them to reduce the risk of transmission. To support these enhancement measures, we will cancel quarantine orders issued. Those who are under quarantine orders starting from tomorrow, they do not have to be quarantined anymore. And we will also, in an orderly manner, arrange for people who are staying in quarantine facilities to be released. We will also arrange for gazettal of the arrangement.
The isolation arrangement for confirmed cases will remain the same. We'll closely monitor the development of the epidemic locally and also isolation arrangement in other parts of the world for confirmed cases, the asymptomatic cases in particular, and we will adjust our measures correspondingly. Because of the change in measures, the government will no longer send out anti-epidemic kits to confirmed cases or to close contacts, but will continue to distribute anti-epidemic kits to confirmed cases under isolation. We will also cancel the vaccine pass arrangement. Since the introduction of vaccine pass has been effective in encouraging members of the public to get vaccinated, and it has successfully raised our vaccination rate. For those who have received the third dose of vaccine, in February it was 23%. It has greatly grown to 83% now. So the Hong Kong has established a rather sturdy immunity barrier, and it has laid a firm foundation for return to normalcy in Hong Kong. And during the fifth wave, those who have been infected and recovered and taking into account our effective vaccination rate, that is those who have received 3 doses of vaccines and those who have received 2, as well as infected, the overall effective vaccination rate for 3 doses is now 94%. Now, maintaining the vaccine pass may still bring benefits, but that it has outweighed the cost to the community. So we have decided to cancel the statutory vaccination or vaccine pass system under CAP 599L, the Prevention and Control of Disease Vaccine Pass regulations. However, I reiterate that we'll continue to look for more targeted measures to protect the old and the young, who are high-risk groups in particular. We will enhance their vaccination rate the soonest possible, hoping to protect their health. The third measure is the testing requirements for inbound travelers. The mainland, taking into account the changes in the pandemic in the mainland and other parts of the world. Now, in early December, the percentage of imported cases is now 5.8% from the mainland, is on a par with that from overseas. So, taking into account the need to resume the flow of people between Hong Kong and the mainland, we have decided to enhance the requirements. We will streamline and apply all inbound traveling requirements for all travelers. Specifically, all inbound travelers, regardless of their source, will have to do an RAT no more than 24 hours before pre-departure, or a PCR test no more than 48 hours before pre-departure. We will do away with the requirement to fill in a health declaration form. However, people can choose to do so electronically, and they can also keep an image of their negative RAT kit result or a PCR report for inspection if required. And all requirement to do PCR tests on arrival will be cancelled. However, we will issue health advice to all arriving passengers. On day 0, that is the day of arrival, to day 5, an RAT test is suggested, and they should also take care of their health conditions. And the fourth measure is to cancel the majority of social distancing measures, including the ban on group gatherings in public places. However, the requirement to wear masks will remain. In the past few months, while we want to protect public health, we have adjusted social distancing measures to allow more extensive social activities and allowing more to take part. Because the public hope to resume normalcy, we will do away with most of the social distancing measures, including the prevention and control of disease requirements and directions, business and premises regulation, CAP 599F. We will remove all the requirements and restrictions on the operation of catering premises and premises. We will also remove the restriction under CAP 599G, and that is the prohibition on group gathering. But as the CE said just now, we strongly appeal to the public and the industry to ensure hygiene in their premises. There should be good air ventilation and regular disinfection of public places, and also no share or share use of personal items, and there should be soap, hand soap. And then we intend to keep Cap 599I, the requirement to wear mask in public means of transport and public places. The wearing of masks is an effective way, an important way to prevent the spread of infectious disease. It can protect yourselves as well as other people. Hong Kong is now at a winter seasonal surge of flu. Experts are of the view that if we do away with the requirement to wear masks, may bring a rapid surge in the number of people with respiratory diseases. We don't want people to suffer from both seasonal flu and COVID-19. We have to protect our public health care system, and so we've decided to keep the mask requirement. All these measures will take effect tomorrow, and that is the 29th of December, Thursday. The second part of my report is arrangements to safeguard our local healthcare system. We will gradually and progressively adjust our anti-epidemic measures so that life can resume normalcy and we can resume contacts with other parts of the world on the premises that we ensure that we have enough resources, healthcare resources, and local people will have priority in receiving healthcare services. To safeguard our healthcare system, the HA has been enhancing its capacity to cope with emergency and the use of resources. HA will provide relevant support to its staff. It will continue to explore cooperation with the private sector. Private healthcare service providers can help to provide outpatient services as well as hospital services to lessen the burden on our public healthcare system. And we have given Paxlovid as well as molnupiravir, two antivirals, to private clinics as well. We strongly appeal to private hospitals and clinics to assist more patients and provide them with appropriate healthcare services to lessen the burden on our public system. And our priority to Hong Kong residents when it comes to medical consultations, HA will provide services and drugs to local residents as a matter of priority. Non-eligible persons such as tourists and non-Hong Kong residents cannot use designated clinics of HA and also medical consultations. Our A&E department will only provide treatment to urgent cases. Non-eligible persons using our A&E services and public healthcare services will be charged a higher rate following our established policies. For instance, at our A&E department, we charge a non-eligible person $1,230 per consultation to ensure the local residents have priority in using these services.
In relation to over-the-counter medication like paracetamol, our public healthcare system will dispense medication, including those with paracetamol and other painkillers, maintained a sufficient supply. The Department of Health as well as the Hospital Authority HA has increased their order. We will make adjustments to our arrangements to make sure that there is sufficient supply to deal with emergencies. In relation to COVID oral medication, there is sufficient stock in our public healthcare system. The private sector can now order the two COVID oral medication directly from pharmaceutical companies. Those who are confirmed can directly obtain the medication from the private healthcare sector. If a patient is prescribed with COVID oral medication paid by the government, they will have to pay accordingly. For each course, the fees will be $6,000. Our objective and our policy is to ensure that there is sufficient vaccine available for Hong Kong residents. Comirnaty and CoronaVac under Cap 138A, the Pharmacies and Poisons Ordinance, have registered. This proves the efficacy of the vaccine, and it also shows that vaccine manufacturers can supply relevant vaccines to relevant healthcare organizations for them to provide vaccination service. The government has procured sufficient vaccines for the use of Hong Kong people. That is sufficient stock for the use under our vaccination program. For bivalent, Comirnaty, and children dose, the supply is higher than the demand is higher than the demand of ancestral virus. So starting from the 23rd of December, we have made adjustments to the vaccination program. For bivalent, Comirnaty, children dose, priority will be given to Hong Kong residents free of charge. In relation to ancestral virus, Comirnaty vaccine, as well as its use as a booster, you will have to stay in Hong Kong for at least 30 days before you have access to the vaccine as a booster. We'll continue to monitor the supply of vaccine and make adjustments accordingly. We want to prevent visitors coming to Hong Kong to use the vaccine at the expense of Hong Kong people, and we will not offer government-procured vaccines free of charge to non-Hong Kong residents. In relation to the private sector, that is a commercial arrangement. It's a different system separate from the government. So provision of vaccination in the private sector will not affect the supply of vaccine to Hong Kong people by the government. Private hospitals and private clinics would like to provide bivalent vaccine when it's available. Hong Kong people or non-Hong Kong residents, it can go to the private sector to obtain the service. I'll now move on to a different area, the protection of targeted groups. I must emphasize that we will continue to actively protect high-risk groups, including the old and the young, as well as those staying in residential care homes. The government will continue to operate community isolation facilities. These facilities are for the use of people who are afraid that they might cause higher risk if they are left in a domestic setting. If need be, these people will be moved to the community isolation facility to protect those who need protection. Daily RAT as well as regular PCR will be a requirement for those working for residential care homes. Residents will have to get tested every day with RAT. Visitors will also have to do tests as required. The Education Bureau will take stock of the situation and make adjustments to their RAT requirements. They will also consult the CHP as well as schools. Our preliminary idea is that for primary as well as kindergarten students, they can't take care of themselves, so daily RAT will stay. The government will stop restriction and testing orders. However, we will continue to operate the over 80 community testing centers for those who would like to get tested. There will be free PCR tests for those who have the need and those who have made a booking. And for those people who require PCR test proof before they leave, for 48 hours before they leave, they may pay to get the PCR test done at these community testing centers. The last part is in relation to monitoring of the situation for public health. This is a new stage of the COVID situation, and we have already made adjustments. The fact is that there is still a large number of cases. According to our sewerage surveillance program, we still see a high transmission of COVID in the community. COVID together with seasonal influenza will put a lot of pressure on our public healthcare system. We still need to protect the old and the young in a targeted way. We will continue to closely monitor development of the epidemic as well as possible mutations. We'll continue with the sewerage surveillance program. We will conduct tests regularly. We will also carry out random tests of samples obtained at community testing centers to do genome sequencing, so that we will be able to monitor the presence of variants of concern defined by the WHO. We will all work together. I ask you to get vaccinated as soon as possible, wear your mask, protect yourself properly, and to protect high-risk groups.
Questions. Please identify your media outlet, and then please ask only 2 questions at a time. The journalist in gray. Good afternoon. I'm from CCTV. I'd like to know the development of the pandemic in Hong Kong. Has the government been effective in fighting the pandemic, and how do you strike a balance between the need to develop the economy and to contain the pandemic? Thank you for your question. We have just given a summary of what we have done to fight the pandemic since the start of this term of the government. We have been monitoring the development of the pandemic and then adjust and enhance our measures correspondingly, because we know that sooner or later we have to fight the pandemic as well as ensure economic activities can take place. We have around 20,000 cases per day in general. But for most of the cases, they are light and some are even asymptomatic. Of course, unfortunately, we have death cases on a daily basis, but we have noted that many of them involved cases with underlying diseases, with poor immunity. And if the vaccination coverage is sufficient, the occurrence of serious cases and even fatality can be reduced. our focus is to prevent serious conditions and fatal cases and focus on protection of high-risk groups. For the rest, we advise them to take sufficient health protection measures. We have gone through a few years of the pandemic, and they are very well equipped. You asked us about our general situation of the pandemic. It's true that we still have confirmed cases, and we're noting whether we are at a plateau or will there be changes. We've also got the seasonal flu. We are under pressure, but as I said, our vaccination coverage has been high. As said by Professor Low, over 83% of our population has received 3 doses, and 2.5 million of the population have been infected. So together, we have 94% of the population well protected by vaccines. So while we still have confirmed cases, the risks are controllable and manageable. The community has this expectation to resume normalcy. And you look at the measures we introduce here, we are ensuring that the pandemic risks are manageable, and then we can promote normalcy. In the past few months, we have moving towards this direction, and we are rather cautious and stable and in a controllable and manageable manner. We do not backpedal, and we are confident that we can gradually resume normalcy. We have already relaxed social distancing measures. We have, in principle, lifted all of them, with the exception of the requirement to wear masks. I'm sure the economy will recover even better. During Christmas, we were happy, and many members of the public said that they had never been so happy before. I was pleased to see that, and that is our target as well. I'm sure we'll be more hopeful, and there will be more economic activities. We have greatly enhanced our arrangements. Many travelers will be happy to come to Hong Kong. I'm sure even the tourism industry will recover, not to mention business activities. So I am optimistic, and I think the epidemic risks are also manageable. Next, the gentleman in black in the front. Chief Executive and Professor Low, good afternoon. Please identify your outlet. I'm from HKET. The first question is on resumption of cross-boundary travel. I'd like to know the date when that will take effect. Is it the 10th or the 8th of January? And will business travelers or family travelers be given priority? And I'd like to ask about the requirements. Now, you just mentioned that the requirements for mainland and overseas travelers will be consistent, and then they will only be given health advice to conduct 5 days of RAT. What if they ignore that advice? And then for overseas travelers, they're still required to have had 2 doses of vaccine. I'd like to know whether the same will apply to mainland visitors. I'm sure that you're all eager to know about the arrangement for resuming cross-boundary travel. After my visit to Beijing, I said that there are 3 principles for resumption of normal cross-boundary travel. First, gradually, and second, orderly, and third, comprehensive. So after we have been successful in introducing orderly and gradual arrangement, we will ensure that we can have full resumption. Now, because we have had the suspension for a few years, we have to ensure that there won't be chaos. We have to ensure that there will not be long queues or jams or confusion and even injuries. We don't want to see that. So we're going to do it in an orderly manner. The CS4A has said to you a number of times that we have been in contact with mainland authorities. So our target is to do it gradually and orderly and comprehensively. Our objective is to, by the middle of January, come to an agreement with the mainland authorities and to ask for approval from the Central People's Government for implementation. Of course, my target is to have the approval by the 15th of January for implementation. That is the target we are moving towards, and the goal is shared by the mainland authorities. So I'm confident. Secondly, what is meant by gradual and orderly? By common sense, we know that there are 4 checkpoints, or rather 4 ways to come into Hong Kong: by air, by sea, by railway, and then by road. Now, when it comes to flights, from 0 flight to well, we may start with 2 flights and then 3. That is gradual and orderly, and then point-to-point resumption. We may start with 1 departure point to 2 or to 3 to Hong Kong. Again, we have to do it gradually in an orderly manner. And for sea traffic, now, ferry services will be resumed in an orderly and gradual manner, and the same applies to railway checkpoint to Hong Kong. But for land border checkpoints, as we all know, we have the highest traffic to Hong Kong through our land checkpoints. Before the pandemic, in 2019, we were handling close to 500,000 per day. So we have suspended for 3 years, and we have geographical constraints at our boundary checkpoints. We have limited capacity in our throughput, so both sides have to make arrangements. Now, our greatest concern is not government manpower. We can deploy manpower very easily. But the greatest concern is the flow and also supporting measures. We have to test whether the flow can be smooth. And as regards the actual requirements, at the point of resumption, well, we are now putting forward different proposals. Hopefully, we can come to an agreement as soon as possible and report to the Central People's Government for approval. I know this is close to your heart, and I have asked about each minor detail, and there have been non-stop meetings recently, and there are different proposals made. We have to ensure that we have the capacity. And secondly, we have to ensure that there are supporting conditions in the community. And then we're also talking about the daily quota that should be adjusted flexibly based on actual circumstances. And that is the first step. Now, if we can handle that amount of passengers very smoothly, then further we can enhance the quota. We're discussing with mainland authorities. I'm sure our own people will be happy to cooperate. So if we can do it in a safe, orderly, and a gradual manner, I am positive. I'm sure we'll be able to handle it.
Yes, in relation to requirements for inbound travelers and its alignment, I would defer to Professor Low. I am aware that for someone coming from overseas, someone who is unvaccinated, the entry will be denied, and the arrangement will be different for people coming from the mainland. In our adjustments this time round, I bear in mind that I want to make sure that everything will be implemented smoothly within a controllable risk level. So we will not make huge moves. We will first make smaller steps, monitor the situation before we make further decision. If we assess that the risk is controllable in Hong Kong, then we will take the next step. As Professor Low said, we will closely monitor arrangements relating to isolation orders and the development of the epidemic situation before we decide on possible further enhancement measures. I'll now defer to Professor Low about the requirements for inbound travelers. Professor Low, thank you. We've been through the epidemic for 3 years. People know about COVID a lot more now. We think that it's time for the control of the epidemic to be partly handed over to members of the public. That's why we've decided to remove quarantine orders and the classification of close contacts. For people who are more vulnerable, we advise them to carry out relevant health arrangements, say for example PCR tests. For inbound travelers, we have adopted the same measure. We give them health advice that they should do RAT tests on a daily basis for 5 days upon arrival. This is along the same vein as requirements under quarantine orders for close contacts. The person in black at the front.
From the South China Morning Post, some English questions. The first, Mr. Lee, you have earlier cautioned against a rapid reopening of the city amid the pandemic. Why has this round of relaxations come so suddenly? It now seems like the government is now at the mercy of Beijing in terms of the pandemic restrictions. How would you tell the international community or perhaps investors who could have this perception following this announcement? And we'd also like to ask more about why the government has decided to make a U-turn on the vaccine pass while the vaccination rate among the elderly and children remain low. And what strategies will the government decide to adopt to boost the vaccination rate in the future? And does it mean that, and at the same time, we also like to ask a bit more about the border reopening. You said that your goal is January 15. Does it mean that you aim to reopen the border by January 15? And what are also the measures that follow afterwards? Thank you.
Well, first of all, I will not agree with your comments that this is sudden or rapid. If you look at what this government has started to do since assumption of office, we have always been preparing for us progressing towards normalization. I think I have said this many times, but I have to do it progressively, orderly, and under control so that we can assess the risk as we go on. Well, I think people have seen how this is being implemented. So it is not rapid, it's not sudden. There will always come a day when we have to make big decisions about normalization. That is exactly what we are doing now, because the time is appropriate for us to do it, having prepared for 6 months to do all these. In fact, I think society as a whole is preparing, because I've been hearing a lot of voices saying that this is the thing to be done. So it's not just the government. I think the whole society is preparing for this. So I wouldn't agree with your comment. And we are doing all this according to our local epidemic situation. The second thing is about the vaccine pass. The vaccine pass has been very successful in promoting vaccination for all of us. And that is why we have successfully reached a 93% vaccination rate for 2 doses and 83% for 3 doses. And plus, what Professor Low has explained, we have over 2.5 million who have been infected. So generally, we have built quite a strong community immunity against the virus. We have very good confidence that we can control the risk because the medical service has enhanced its response system, and also we have sufficient and effective medicine, and the community has good experience after 3 years to protect themselves, and Hong Kong people as a whole are very compliant with our measures, and I thank them sincerely. So the whole focus of our strategy now is to reduce death cases and serious cases and protect high-risk group, which includes, of course, the very old and the very young. So everything has been progressing according to plan. And of course, we have to assess for each measure that we are implemented, the return and the cost. We have pushed up the vaccination rate to such a good level, almost 94%, as explained, the overall protection. And we are proceeding to normalization. So I want to tell the world that, well, this is Hong Kong. Hong Kong is very normal now. And that is why it has come to the right time that we will do without the vaccination pass. And that is exactly what this government has been planning to do for normalization. It has come to a time where we don't have to rely on the vaccine pass, and we do another measure, which is to focus our vaccination program on the high-risk groups. And regarding the normalization of travel with our mainland, then of course I think everybody, or this is the voice of a lot of people, and I'm very thankful to the Central People's Government for making this direction, that we will resume normal travel with the mainland, step by step, orderly, with a view to full opening, full normalization. And that is what we are doing now in close discussion with the authorities of the mainland. It is my intention to reach an agreement with our counterparts no later than a time so that we can report to the Central People's Government for endorsement, for implementation before the middle of January. And every party has been working hard towards the program. the government, 15 bureaus, have been working over the Christmas time to make proposals to ensure that when we start to resume normal travel with the mainland, then it will be done orderly, safely, and also allowing people concerned to have a good experience. We don't want chaos. We don't want things to happen which will be damageable to our overall safety. That is the goal. And we want to reach the agreement as soon as possible for implementation before the middle of January.
The journalist in a blue mask? No, the one wearing a blue mask. I'm from Now TV. On resumption of cross-boundary travel, is there any consensus on the checkpoints to be opened first by air or land or sea or air? And will there be any quota? Do you have any common goal with the central authorities whether it should take place before the Chinese New Year? And do you have any target of keeping the mask wearing requirement for a certain time? And will there be any adjustment or relaxation in the vaccination rate of school children in resuming whole-day classes? Yes, we are all concerned about resuming normal cross-boundary travel. And what you said is being done by the CS4A, leading the task force for resumption of normal cross-boundary travel. And after my trip to Beijing, I explained to the media the checkpoints to be opened and also the number of travelers allowed per day. We will try to maximize the number as far as possible. All these will be discussed with mainland authorities. And also the conditions required. We need to come to an agreement for orderly implementation. To put it simply, we have to ensure that we have the capacity. And then crowd control must be safe and orderly. I don't want people to wait in long queues, leading to an unpleasant experience. Since we're all looking forward to the reopening of borders, I hope we can make a proper arrangement. I hope the experience will be pleasant and smooth. As regards when, as I said, hopefully we can do it. We can have the approval of the central authorities on the 15th, the latest. And as for the number of passengers allowed, as I said, we're going to review the situation on a daily basis and adjust the daily quota accordingly. If things go smoothly, and if passengers on both sides, travelers on both sides can cooperate, then it would be better because we want to do it in a gradual and orderly manner. As for the requirement to wear mask, Professor Low can reiterate later, because on the one hand, we want to open up as far as possible. We have lifted all social distancing measures with the exception of the requirement to wear mask. This is because we are now at a high-risk period of the seasonal flu, and we have to understand the development of the mutant strain of the virus. While we are aware, or while we know a situation, we cannot rule out possibilities. With new mutation, there may be new risks unforeseen. So the wearing of masks can safeguard our overall health, and is also the most effective way of controlling the disease. We can stop the disease from spreading, and we can also protect ourselves against infection. And as for schools, as Professor Low said, the Education Bureau will first discuss with schools. I've just announced the new policy. The ED Bureau will have to make adjustments, and communication is just as important. Professor Low has also stressed the point that we have to protect the high-risk groups. Students should be protected. In particular, the younger students may not have a strong sense of infection control, and the the vaccination rate among them is not as high as expected. And our students do gather together in schools for a large part of the day. I believe schools will make some flexible arrangements. There will be appropriate adjustment to the current arrangements. I will allow the Education Bureau to consider the issue first, and in consultation with the Health Bureau, communicate with schools. Now, I understand that it takes time for schools to make appropriate arrangements. Let's see if Professor Low has anything to add. In reviewing each and every measure, we will balance the infection control efficacy against the social cost. Many experts are of the view that the wearing of masks is important, in particular during this winter when we are faced with the risk of COVID-19, seasonal flu, and other respiratory diseases. So, wearing a face mask is very effective and important, and we have to bear the cost for a longer while. And during the seasonal flu, we believe we will have to keep our masks on. As for schools, we have to understand that given the situation in schools, it's quite easy for clusters to occur in schools. This is particularly the case in childcare centers and kindergartens because students are there together in a group, and we have to understand that the vaccination rate among our young children is low. We have just seen a 31-month kid passed away, and so far 12 children have passed away because of COVID-19. So we have to protect our children. Any form of respiratory clusters in schools is a matter of concern to us. The Center for Health Protection will make recommendations to prevent large-scale outbreak in schools or in classes. So in considering whether testing requirements for students should be adjusted, we'll be very cautious, bearing in mind the vaccination rates among different age groups.
Because of time, we allow 2 more questions. The reporter at the front. Good afternoon, everyone. I'm from Phoenix TV. My question is, there are saying that there is opacity in the diseased lungs in mainland cases. Do you know that if there is a new variant on the mainland, if that is the case, how do you guard against it? Why do you choose now to relax these measures? I would also like to ask about medication. Previously, Macau has opened their borders with Hong Kong. And subsequently, there is a shortage of painkillers and medication for fevers. They said that they will increase procurement. If the border is open on the 8th, will the situation be worse? How do you ensure that local residents can buy the medication they need? Would you implement a real name purchase system? First of all, the continuous adjustments of social distancing measures has been done over the past 6 months, so it's not sudden. I believe that we have cancelled the flight suspension mechanism a couple of weeks into our term, and we've been talking about doing things in a precise way. We rely on data. We want to allow maximum resumption of activities while controlling the risk effectively. I do think that our approach has been successful. At this stage, we're of the view that the majority of the social distancing measures can be lifted. We have changed from centralized isolation to decentralized isolation. Previously, we had 0+7. We changed it to 0+3. We have implemented targeted measures to allow mega events to take place. The risk of these events has been kept under control because of our targeted measures. We have seen a series of international events and mega events. Everything has been meticulously planned. So we have been very professional and successful in our risk control. We have been taking steps in the past 6 months to reach this stage. So everything we have achieved has been built on a solid and grounded and well-planned approach for control and information of cases on the mainland. I'll defer to Professor Low. About information of cases on the mainland, I should caution you against unverified information in relation to new variants or opacity in the diseased lungs. I ask you to carefully check the origin. The National Health Commission has already clarified. As far as we know, the prevalent variant on the mainland is still Omicron, no different from anywhere else in the world. And so far, there is no presence of other variants. In relation to medication, I'll defer to the Center for Health Protection, Dr. Choi Lok-kin. He'll give you information about the supply in the public and in the private sector. Dr. Choi. Paracetamol is a medication to tackle fever, and that is available for use for patients in the public sector. For confirmed cases, previously we have been issuing a package containing paracetamols. As far as we know, that we have been liaising closely with pharmacies because there are local manufacturers producing paracetamol, so we think that there is sufficient supply for the use of local residents. I ask members of the public not to just select a certain brand because paracetamol can be found in a lot of medications of different brands. Last question. The lady at the back.
Okay, so will the government consider dropping the mask mandates as well, and when? And also, the second question is about Japan airport restrictions. So are the return flights from airports in like Okinawa going to be time limited? Thank you.
I shall leave the masking measure to Professor Low. In regard to the measures that the Japanese government has introduced in such a way that flights can only be allowed at 4 airports, we have done several things. First of all, we have indicated to the Japanese government that we are disappointed with the arrangement because we think that Hong Kong people and Hong Kong flights should be allowed to use not just these 4 airports. And we have also approached the Consul General of Japan in Hong Kong to relate that message. Besides that, our ETO in Tokyo is trying to help anybody who needs assistance. So is also our immigration officers. What we have been doing is ensuring that we help passing the necessary information to particular Hong Kong people who need assistance. Basically, they want information so that they will be able to make special arrangements. I know that some airlines are already making alternative arrangements for the passengers, including where they can, they arrange ferries to transport some passengers to the 4 airport. Our ETO stand ready to assist anybody. So is the immigration. We will stand by for any extra requests that Hong Kong citizens may have, so we will offer our help. I wish the arrangement can be lifted as soon as possible. As regards the masking requirement, I'll pass on to Professor Low.
In considering the adjustment of all these public health measures and anti-COVID strategies, we balance the benefit versus the cost. The benefit of masking, at least, especially at this point when we are facing a serious winter surge, is tremendous. We need to continue with the masking mandate in order to protect our citizens from the risks of not just COVID, but also influenza and other respiratory tract infection, which will be, we will be facing the winter surge actually for now and actually in the next couple of months. So in terms of this measure, we will be keeping it for until we get over this winter surge.
好，今日嘅記者會到此為止，多謝大家。
That's the end of the press conference. Thank you. New Year's around the corner. I wish you all a happy new year. Thank you.